And with that, since we wasted a few minutes getting organized here, I'll hand it over to Holly. Thanks, Holly.
Oh my, Chelsea, thanks everybody. I'm really so sorry. I have no idea what happened. I mean, I have no idea. It's never happened before. So Chelsea and I, for the last 15 minutes, have been emailing back, what's happening? What are we going to do? So I'm really sorry about that. I know we're a little bit late starting. So I think what I'm going to do is jump right in because we're a little late starting. Yeah, I echo that. Please feel free to raise your hand at any time or, unmute and chat. Put questions in the chat. That's fine. I'm happy for this to be a discussion. So I'll also say, yeah, I thought we might lose our power today. We'll see what happens. If in the event we do, it's possible we will, then I will simply record this session at some point in the next couple of days and we will post it. It's just tough to keep rescheduling things. So hopefully we won't, and it won't be an issue. So I'm going to talk a little bit about some things to think about in designing a survey. Not that I think I'm any kind of survey design expert, I most certainly don't. But in the course of my career, I have designed a few and I've made a lot of mistakes, quite frankly, in doing it. And so I've learned a few things along the way, I hope anyway. So I just want to run down through some of these different sort of steps or things to think about in designing a survey. And there may well be some of you on the line who have lots of experience as well with designing surveys. So I find it very helpful to share experiences. So feel free to do that. Anything I say, if you have a comment, a question, if it rings true to you, or if it's something you do in your survey work, please feel free to jump in at any time. So these are the different things I'm going to talk about, sort of thinking about your question, hypothesis, thinking about what we've already done or what's already been done in the literature, choosing an existing scale, different types of surveys, then a few slides on sort of some overall survey design tips and things to think about, and then specifically thinking about your items and your response rates, that sort of thing, response scales. So we'll talk a little bit about all that and how to optimize response rates, or at least, well, maybe one idea to help optimize response rates at least. So I want to kind of start right at the beginning, which is thinking about why you're doing the survey to begin with, which sounds really simple, doesn't it? And simplistic almost. And I apologize, I don't mean to make it sound so simplistic, but I think sometimes it's the most effective way to actually design a good survey. Really think carefully about what are you trying to do? What are you trying to measure? What is your objective? What do you want to do at the end of the day? Are you trying to test hypotheses? Do you want to generate hypotheses? Do you want to do both maybe? That might impact things like open versus closed questions, for example. What I try to do at the beginning of my own work is to think about as many, at the beginning now, as I'm brainstorming, as many and as specific objectives or hypotheses as I can. Surveys can be quite long, as you know, and when they are, it's burdensome, right? I'm sure we've all filled out surveys, and I'm sure all of us at times thought, oh, is this ever going to be over? At the beginning, though, when I'm brainstorming, I do try to set out as much as possible, and then I think about, oh, okay, do I really need this hypothesis? Is this one really important? The reason I do that is because it really helps me focus on the items. So, for example, let's say you want to measure risk perception or the risk of some people's risk perception of some risk of a condition, let's say a health condition. So you have to think, okay, what do I want my outcome to be? Is that an outcome? Do I want it to be a number? Do I want a numerical measure of it? Do I want a composite measure of it? So for example, if you look in the literature on risk perception, and you'll have your own literature, of course, for your topics and content area. We know that risk is often a composite measure of things like self-efficacy. Do I feel like I have the skills and the ability to do something about this risk? Severity, how severe is it or not? Susceptibility, do I think I'm highly susceptible or not so highly susceptible, etc.? Do you have a hypothesis about risk perception? So again, this is just one variable, right? Risk perception. You may have many and many on your survey, but I always try to think really carefully about the analysis. For me, I have to say, in my own work, this has probably been the most helpful thing to me at the beginning of a survey, trying to craft my items, is how am I going to analyze it? What stats am I going to do? When I write up this paper, or if you're a student, you write up your thesis, whatever the case, what do you want to be able to say about it? And I'll tell you how I learned that very early on in my career. I forget what the survey was about now. I can't remember, but it was a big effort. It was about, I remember it being a big effort. And whatever we had measured, the key outcome variable, when I got to the end of the day and started to analyze the data, I realized, oh no, I measured that in a yes or no. So the question, whatever it was, the answer was yes or no. I wanted to give a mean of something. So I could do a t-test or an ANOVA or a regression. And I realized I had measured it with a yes, no, and I was devastated when I realized it. So that really taught me something a lot. That was back when I just started a postdoc a long, long time ago. And ever since then, I'm now so careful to think, how are you going to analyze this? Hang on, what is this number going to look like? What are you going to do a t-test? Are you going to do a regression? What are you going to do? So I actually find that really, really helpful. Okay. So just thinking about why you want to do the survey to begin with and what you're hoping to get out of it is really spend time up front doing that, because the more time you spend up front, it's been my experience, the easier the survey is. It looks better, you have a decent response rate, and you know how you're going to analyze it. So I always spend time up front, I have to say, spend a good bit of time. You have to know what's already been done, right? We all know, I'm sure you all know, that there are so many measures and surveys and scales in the literature, right? So many of them. It makes it really tough to compare findings across studies. In the risk perception world, that is very true. There are so many surveys and scales. So save yourself a bit of time, first of all, if there is an existing measure. And I think particularly if you are talking about comparing, let's say, maybe your findings in your population to a national population or to some national norms, then it makes perfect sense to use an existing measure. Where do you find them? Here's just 3 examples for you, bureaus, HAPI, and the APA. But look at the last line here. I find you really have to spend some time searching the literature, or I certainly do. I just don't know off the top of my head how many depression measures there are, or how many measures of pain there are, or et cetera, et cetera. So for me, it takes a bit of time up front to look through the literature. But, you know, sometimes it's really worth it, again, depending on what you want to do at the end of the day. So I'll give you one example, happened recently. Dr. Kathy Hodgkinson here at Faculty of Medicine as well, and we just finished supervising 3 master's students. They've all graduated now within the last couple of years. And their concern was about mental health, in particular, measures of anxiety, depression, and post-traumatic stress in a very particular population in the inherited conditions. And a lot of Kathy's work is in an inherited cardiac condition. And we had thought, you know, you spend so much time focusing on the clinical aspects of that disorder because it confers a very high risk of sudden cardiac death. So, of course, you have to think about the clinical and save people's lives. That makes perfect sense. But as a result, there's been very little work done, particularly on those family members, the people who test negative, the wives and husbands, the partners of the people who are living with that risk, that no one's really looked at their mental health. They're very, very little. So our 3 students decided to look at mental health in that population. And because we wanted to make some statement about, we thought, we weren't sure, but our hypothesis was, I think that some of the members of these families are actually going to score higher than the general population norms in Canada for, you know, distress, anxiety, and post-traumatic stress. So because we wanted to make that, because we really want to make the argument to advocate for these families, right, to decision makers, to policymakers, maybe we need to start thinking about these folks, these caregivers, these spouses, et cetera. So we did search the literature. We did find 3 very well validated, robust, used across the world measures. And so we thought, well, why would we try to create a new one? Here are these measures. We have population norms. What we found, by the way, is that the caregivers, the spouses of those people who carried that risk for sudden cardiac death, so they themselves were not at risk, the spouses, they actually scored, I forget what the number was, but it was significant, quite above the norms for Canada in the general population of post-traumatic stress. So it's a pretty powerful statement to make. So it's just a tangible example of how using an existing measure can be a really smart thing to do depending on what your goals are. So it kind of gets back to what I was saying earlier, right, about knowing your hypotheses, knowing your objectives, knowing what you want to do. So I hope that makes sense. Okay, so let's talk about that for a second, using existing measures. So I've got a few slides here on kind of validity, reliability, scale development, because sometimes I see in the literature or I hear investigators talking and we talk about, oh, I'm going to develop a scale. Scale development is actually a study in and of itself. It is a huge amount of work. I can guarantee you, I don't think in my career I'll ever develop a scale because it's just too much work. I have great respect for the people who do that. So I just want, when you're considering developing a scale, or sorry, using a scale, forgive me, picking a scale, as we did with our students, you do need to think about validity and reliability. They're both important. You want good reliability and validity because if you don't have them, you have a lot of biases and errors and just not as much power in your data, for example. So let's talk a little bit about validity and the different types of validity. If you were developing a scale, some of the things you might have to do. These scales that are well used. So for example, things like the HADS, the Hospital and Anxiety Depression Scale, or the Beck Depression Inventory, or the SF-36, kind of a measure of physical and psychological health. These things have been around for a long time. They've been well developed. They have statistics, validity and reliability statistics associated with them. So if you use those sorts of scales, you can very easily cite the literature to say, hey, this scale has good validity and reliability. Ideally, when we're thinking about validity, we'd have some objective way, right, to measure our construct. So whatever that is, if we're measuring attitude about something or quality of life or job satisfaction, whatever it is. But usually there's no objective measure of quality of life or job satisfaction, right? So there's no one way to perfectly demonstrate like a scale's validity. You're usually trying to build an argument with a bunch of different pieces of information. So some of the things you might do is begin with a kind of a quick check almost. So we think of these as a quick form of validity, face validity and content validity. You're really reading it quickly. Your investigative team is reading it to say, well, does it seem to be measuring what I think it should? If I'm measuring quality of life, do these items seem to be measuring quality of life, or do they seem totally off? Out of base, off base. Are all your domains there? So again, with quality of life, we all know that just logically, forget the literature for a second, but the literature will confirm it, that quality of life is a composite measure of many things, right? Many different domains. So just very quickly, you're looking at this scale or survey you found in the literature, or if you're developing your own, to say, okay, are all those important domains addressed? Again, they're kind of quick. The other things, however, the other forms of validity, again, if you were validating your own scale, are much more time consuming when you're trying to figure out, well, are these items that I have constructed here, or this scale I have, does it actually measure what it's supposed to measure? The concept of internal validity is what we're really getting at now. Is it accurate? And of course, that matters because A, can you trust your findings? Can you have confidence in them, right? And can you infer your findings or generalize them outside of that? So some of the things that contribute to internal validity are convergent and construct validity. So convergent, we're saying, does it correlate with another tool that measures the same thing? So again, if you are developing a scale and you're really doing a full-blown scale validation study, then not only would you have to administer your new tool. So let's say you've created a new tool to measure anxiety. I'm making that up, but let's say you have, and you want to know, okay, is this a good tool? Is it measuring what it's supposed to measure? Then think about it. We know the literature right now has many, many well-validated anxiety scales. So you would have to get your population of people, you would give them your anxiety tool, they would fill it out. The findings from your tool then should correlate with pre-existing measures of anxiety. So your population has to fill them out too. So just think about it. That's why I say, when people say, oh, I'm going to validate a scale, I say, well, that means a very particular thing. So that will be one thing you would have to do, for example, to show convergent validity. Construct validity is another important concept. So what we're getting at here is sometimes some of the surveys we're developing or scales we're developing are theoretically guided. So for example, when I was doing my training years and years ago in psychology, the theory of planned behavior was very popular. I think it's still very popular today, by the way. a theory kind of explaining our intentions to, exercise, to eat more fruits and vegetables, to do whatever. So let's use that one about eating fruits and vegetables. So theoretically, according to the theory, my intention to eat fruits and vegetables is dependent on my attitude about it. Do I feel positive or negative about eating fruits and vegetables? My perceived levels of control. Do I think I have the ability to go out and, buy and get fruits and vegetables and bring them home and cook them, etc.? And subjective norm. Are the people in my life who are important to me, would they support the idea of me eating fruits and vegetables? Okay, so there's a theory about it. So if I were coming up with a survey based on the theory of planned behavior, for example, then, and I would have to go and administer it to a population, I would be looking to see, okay, wait, does intention in this population to eat fruits and vegetables, does it vary by attitude, control, and subjective norm? So the theory tells me, for example, that people who have less positive attitudes about eating fruits and vegetables will be less likely to intend to do so, which makes perfect sense, right? It's a simple example, but it's a simple but powerful theory, actually. It's been used quite a bit. So I don't want to belabor that idea. I just want to point out to you that when we talk about validating a scale, it's a very specific piece of work, and it's quite a bit of piece of work. For you, if you are choosing a scale in the literature, you don't necessarily have to worry about all of that. It will be enough that the authors have done that work. And they've said to you, hey, look, we've shown that this has good convergent and construct validity, good internal validity. And then you could say, okay, good. Authors have told me that. Now you might want to read it for yourself to see if they're telling you the truth, but you get my point, right? Reliability is the other thing we think about, which is really getting at precision, the precision of your instrument. So we might measure something in a reproducible fashion from one time to another. Again, if you were creating your own scale, you would have to administer it at one point and then at another point. And you should have similar answers, right? If in fact you're measuring what you think you're measuring. The other thing we talk about is internal consistency, often measured by Cronbach's alpha. And I actually really love this little measure in SPSS when I'm putting together even just my own simple little surveys. It's asking, do all items measure the same thing? And I'll tell you how I use it all the time. So I recently did a survey about whole genome sequencing. And it was a fairly lengthy survey. There was a good bit on it, but there were several sections, okay, to the survey. So one of the sections was about attitude, people's attitude about having their genome sequenced. And in that section, there was, I want to say 7 or 8 items. And I wasn't sure. I'm like, are they all measuring attitude about sequencing? Because having your genome sequenced, there's lots of different facets of that to think about. So, are people worried about insurance discrimination? Would they share the results with their family doctor? Would they share it with their, siblings, etc.? So we had this 7 or 8 items. And once we got back the data, before I could combine those items, let's say, into a subscale on my survey to say, okay, here's people's attitude, where the higher the overall score on these 7 or 8 items, the more positive someone's attitude. Because I thought attitude would be related to some other things on my survey. That was part of my hypothesis, right? So those 7 or 8 items I had in SPSS, I simply bought them all over, hit the Cronbach's alpha, and what I found was that it was below 0.7. So I thought, wait, there's some item here that's measuring something a little bit differently. What Cronbach's alpha allows you to do is remove one item at a time. And the program, I'll use SPSS, sorry, some of you may use SAS or other programs, all the same, I'm sure. But what it does is when you remove one item at a time, it recalculates the alpha. So sure enough, when I did that and removed one, I forget what it was about, I apologize, or would make my example more complete. But when I removed one of them, it brought the alpha up to 0.82 or 0.83, which is a really respectable alpha. So before I created my subscale, I removed that one item, for example. And it's important because the more precise your measure, the greater your power, which is really important if you only have a small sample, right? So I don't want to belabor the talk about that because I am not a scale developer, let me assure you. I just want to make the point that if you were developing a scale, you would have to do all of those things, okay? And so for you, if you are looking through the literature to say, is there an anxiety scale? Is there a depression scale? Is there a pain scale, et cetera, that I can use? that gives you the ability to say, oh, look at that. They're telling me about the Cronbach's alpha. They're telling me about the validity. Okay, I feel pretty good about that. But remember, if you find an instrument that has these good psychometric properties, but you change it, you use only some of the items, then you can no longer cite or claim those exact same reliability and validity stats because you've now changed it, right? So keep that in mind. So final thoughts I would say about this before you develop any of your own scale, really think about it. It can be a time-consuming task. So check to see, do you really need another measure? You know, we have lots of measures of anxiety, depression, a lot of psychosocial measures. Is it worth the time and the effort to do it correctly? So have a think about that. So how's everyone doing? Does that make sense? Any questions or comments or sharing of your own experience with scale development?
I'll
Before I
just,
get,
I'll chime in with something, Holly. I added
yeah,
in the chat a link to the Center for Excellence in Patient and Public Partnership
perfect,
evaluation toolkit for evaluating patient engagement and research. And that's another place you can go to find
perfect.
a host of surveys that are already developed. And that group actually gives a measure of scientific rigor for each of the tools. It seems to be more of a measure of construct validity, but
Yeah,
but
yeah.
definitely a good place to go for that kind of information.
Yeah, absolutely. And I'm sure there's so many databases now that have these tools and stuff that I'm not even aware of. So by the way, anyone on the line, if you are aware of good repositories of surveys and whatnot, please do. Please do share them. There's lots now in the patient-oriented world where we're thinking about patient-reported outcome measures, PROMs, and patient-reported experience measures, PRIMs. I'm sure there's databases of those as well. I absolutely know there are. So it's why I said that right at the beginning to think about searching the literature a little bit, right? And Julia, yes, absolutely right. I see your comment and fully agree. It really is a big undertaking. Yeah, for sure. I have great respect for people who do that kind of work. I just shamelessly cite their hard-won validity and reliability statistics and simply thank them for that work. Okay, I want to move on because we have a little bit, but great. Please continue to share your ideas, everyone. So I think about then different types of surveys. Now, I've put so when you're thinking about doing a survey, here's some of the things we need to think about, right? How will we do it? Will it be a mail out survey? Will it be an email survey? Will it be a telephone survey? Will it be a face-to-face interview? I've included interviews here, which just in the interest of being comprehensive, you can technically sit with people and do surveys with them. Although when I think of an interview, I do think of a qualitative semi-structured interview, to be honest. I'm putting it here in a bit of a different context. And sometimes there are face-to-face surveys that are done with people. And there are a variety of reasons you might do that, I suppose. But in terms of making a decision and what you'll do, some of the things to think about, the methods will differ, right? In terms of, the type of data you get, of course, the practical, logistical differences, how you choose your samples and so on. So these couple of tables here, sorry, and once I can move here, are just meant very brief, quick look at, well, here's how they may differ, right? So, interviews, for example, a face-to-face interview, or even a phone interview, or doing a mail out might be a little bit more labor intensive than sending off an email, right? For example, an email survey. If you're going to do a face-to-face interview or even a phone interview where you have that direct interaction with people, probably need some kind of skill in interviewing, right? The speed, obviously, email, very quick, right? Mail, very slow, right? Traditional mail. Telephone, face-to-face, probably in the middle, right? Costs, really important. What kind of budget do you have? A mail out survey and an email survey are both fairly low cost, right? Others can be higher, depends on how many people you're going to recruit. Do you need some skilled interviewers? Do you need to hire, etc. So again, I throw this out just as things to think about. And how do you make the decision? Part of it, I think, is going to be made by what is logistically and practically most feasible? How much time do I have? How much money do I have? And quite frankly, what is my preference? Do I need to survey a lot of people? If I do, then you're probably not going to do face-to-face interviews with them, right? Because it's going to take a long time, for example, right? How easy is it to reach people? If you have a sampling frame, so if you have a list of people, so let's just pretend, let's say, I wanted to do a survey of all the family physicians in Newfoundland, Labrador, let's just say. And let's say that some way I have a list of them. By the way, I personally do not, but let's say I do. If I were to have that list, then I might think about if they're already listed, okay, I've got their addresses, maybe I will shoot them off a survey in the mail, or maybe I will take a random sample of them and make phone calls to them. I've got the full list, but I don't have everybody's email. So for example, that might make me think, well, maybe I won't do, an online survey, right? So again, thinking about, do you have a list of them? Is it widely dispersed? You only have a partial list, etc. That might influence the decision you make. In terms of your control over the design, I think the design of the survey itself, we always have control over. But in terms of how people will interpret our questions, right? Clearly the face-to-face methods, or just on the phone even, we have that ability to clarify questions, and paraphrase, and they have the ability to ask us questions. So if you think you have a confusing topic, maybe you might think about that, for example, right? Response rates, first of all, response rates are always tough. You never really know, quite frankly, but often the face-to-face, the actual talking to people methods are very generally get higher response rates. The mail out surveys tend to be low to medium, but I'll come back to that later because I think there are things you can do to optimize the response rate. Email, I think, is kind of in the middle. I have found that to be sort of in the middle, right? And Karen, I do see your question, by the way, about the difference between a questionnaire and a survey. Yeah, it's a great question, by the way. And I've probably used them both interchangeably already, right? I'm sure I have. I actually think questionnaires and surveys are the same. What it can be different is a scale. A scale is not necessary. So all surveys are not necessarily scales. But all scales can be a survey, I think. So the scales tend to be measuring something very specific with banks of items that are all measuring whatever, pain, depression, anxiety, right? So the Beck depression inventory or the hospital and anxiety depression scale, there is an anxiety scale, X number of items in the scale, and there's an anxiety and a depression scale, for example. So there's two scales in that. And the reason we can call it a scale is because A, it's measuring the same construct. Whereas, for example, my genome survey measured all kinds of stuff. It measured attitude, it measured interest, it measured, oh my gosh, concerns. It was measured demographics, a whole bunch of stuff on that survey. It wasn't meant to be an attitude scale, for example, right? Whereas the scales are measuring something very specific. But I think a survey, and by the way, and the scales require all that work that we just talked about with the validation, right? A survey, I didn't do all that work for my survey, for example. So I'm a little lazy, you see. That's why I'll never do a scale, right? I'm pretty sure. But that's a great question, Karen. Thanks for asking that. But to me, a questionnaire and a survey pretty well is interchangeable for me. But if anyone has heard anything different or you use it differently, please pop in for sure. Happy to hear it. All right, now let me. Okay, here we go. Accuracy of answers. Here's the other thing to think about. If you are doing a study that might have be a cause for people to want to answer you in a certain way, then if you're going to be on the phone with them or certainly face-to-face with them, you might have the potential for social desirability bias, where people will answer in ways they think they should, not necessarily in truthful ways. Now, I don't know, sometimes the classic example of that is, drug use or number of alcoholic drinks per week. It's much easier to say, well, I drink, 4 bottles of wine a week over email than it is to say that to someone face to face, right? So have a think about the potential for social desirability. Usually the face-to-face methods, of course, have higher likelihood of that than the others, right? Same with potential interviewer error. You do need to be a person skilled in asking questions and running these interviews and so on. So again, if you feel like you have a small team, maybe you don't have a lot of people on your team who have a lot of experience, then maybe you might say, maybe we'll do something by mail or by email because I'm kind of afraid we're going to mess it up, for example, right? For lack of a better way to put it. What I would say is I don't think there's any right or wrong answer to what method should I choose. I'm just saying those are some things to think about as you're making that kind of decision and that choice, right? So let's move into overall survey design, because this is meant to apply to any survey. Some high level, top of the head things to think about. that first question really is important. You don't want to turn people off right away, right? So if you can, it should be a fairly easy to answer question. Don't start off with an open-ended question in general, unless you're doing a face-to-face interview. That's a bit different. But any kind of an email survey, or even a telephone survey, I would argue, or a pen and paper survey, go with a closed question, and don't have the sensitive questions up front. They usually are at the end. Demographic information, education, income, alcohol consumption, etc. The more sensitive things, or that we might, I know not everyone will read them the same way as sensitive, but in general, there's certainly some consensus in the literature, I think, that certain things are a bit more sensitive than others, and we leave them to the end. The first question also really should be applicable to everybody. There's nothing worse than opening up a survey and the very first question is not applicable to you. Think about it. That doesn't really keep your interest, right? So try to have a first question that's relevant for everybody, fairly easy to answer, and generally close-ended. The instructions really need to be clear for everyone, and you need to put the instructions where you need them, not necessarily all at the beginning. And in our genome survey, I was just talking about, which, by the way, I'm happy to share. If you want to see an example of a survey with a bunch of different sections, you're welcome to have it. Just have to email me, remind me. But for example, we had a bunch of different sections, and some of them really did require specific instructions. So sequencing can be a complex topic, and some of the topics within it. So incidental findings, or sharing your data in a restricted scientific database versus an open one. People rightly would say, well, what do you mean? What does that mean? A restricted scientific database. So we use vignettes in our survey, which I find very effective. People tend to like them. So we created kind of a hypothetical patient, and we said, well, what about if, let's think about Mary here, and she's being asked to share her data, and we gave them different scenarios, and then we asked them our 3 or 4 survey items about those vignettes. So there's no way we could have put all those vignettes at the beginning, right? And then got to halfway down to the survey and said, now go back and read about Mary. So you put the instructions where they're needed, right? And we tried to pay attention to flow. So we asked, for example, about data sharing in one section of our survey. We didn't ask about it at the beginning and the middle and the end. We kind of had it, right? So the topics were kind of fairly standalone, even though they were all related. Limit branching. This has just happened to me and a master's student, and I am now kicking myself for doing it. I knew it, and I should have followed my instinct. So you know what I mean by branching? If you answer yes to this, then go to question blah, blah, blah. If you answer no, go to question, well. We had a student recently who did a survey, and right at the beginning, we had a choice to make. Her survey was about communication about inherited risk, okay? So talking with your family about genetic test results and genetic risk. And we wanted to talk to both people who had been tested, so they had had a genetic test, they got a result, and they went out to talk to their family. We wanted to get their opinions about a variety of different things. But we also wanted to talk to their relatives. We said, the people who are sitting at home and maybe did or did not know that their relative was having a genetic test, not always do know, we wanted to get their perceptions as well. What do you think? So we had a choice to make. Will we do 2 surveys, one for the relatives, right? And one for the, what we call proband, the person who had been tested. So we chose to do it all in one survey. And what that meant was we needed to do a lot of branching. We had to say, are you a person who has received a result and gone and told your relatives? If yes, click 1. I so regret it now. I knew in my heart we should not. Why did we make that decision? We made it because it was a master's student project. So we had a little bit of a time crunch, right? It was a master's student, had to be done in a relatively short period of time. It was also a national survey. So we were trying to sort of use our limited time and resources well. And when we got the data back, we realized that we just had a lot of fooling around. That we did use Qualtrics, by the way, with it as well. And I think people really were confused by all of the branching. We had a low response rate. I actually believe that was part of the reason why. I personally have not designed a lot of surveys with branching. because I don't like it. So I really, really do it. We did it that one time, and it was the student kind of was her project and made that decision. So I don't know, everyone, if there are a lot of software that will enable you to do that. But if that's the case, then great. If a survey software will do that, that is the thing to do, because it is very irritating. But even on a pen and paper survey, think about it. If you're sending out a survey in the mail, even, it's still relevant to keep that in mind. Anytime you can limit it, because it really can be confusing for people, and it can just be irritating. I would argue it may make people angry. So Amy, thanks. Qualtrics can do that. Okay, great. Good to know. May just be that we didn't have a lot of experience, I guess, with a relatively longer survey, but that's good to know. Thanks for confirming. Nonetheless, what I would say is, keep it in your mind. If there's a way to limit it, particularly on a survey you're going to put in the mail, I think that's important to remember. Also, think about your order effects. This is often a judgment call, okay, based on your content area, what it's about. So if you ask a question earlier on, will that influence how people answer later? It's a judgment call. No easy way to do it. But if you're worried about it, you could counterbalance your questions. So what I mean by that is, you half the respondents will get the questions in one order, and the other, just randomly, the other half then get a different order. And you can actually test for that statistically if there are order effects, which is kind of cool. Whether or not you should do that, no easy way really to answer that. It really depends on your content area and probably how well you know it, and if you really think that's a possible threat. But the idea of counterbalancing isn't really that complicated, isn't horribly complicated. It maybe adds one extra little step for you, I suppose, in terms of how you make that choice, right? But something to consider. Skip logic, right? Thank you, Amy. Exactly. Perfect. I just want to make sure I don't miss anything here. Yeah, Qualtrics will hand it hidden feature. Yeah, pen and paper branching is terrible. Yes, thanks, Josh. You're absolutely right. I couldn't agree more. I've filled out a lot of surveys as well, as I'm sure we all have, right? Okay, so those are just some high-level thoughts about overall surveys themselves. Let's now think a little bit more specifically, drill down a little bit about item design. So I want to talk a little bit about basic attributes of questions, some common problems with item design, and then think about response scales. So now we're just going to get a little bit more specific. So I would say shorter items mean less mistakes in general. This is something I really struggle with. I don't do anything short. I talk a lot. I write a lot. Okay. I really struggle with it. I need people to read my surveys to say, Holly, you could really cut this down by 8 words. I'm like, perfect. Please do that for me. I appreciate it. So I would say just general, shorter items generally mean less mistakes. Limit the use of or. That can be confusing for people. This is a fairly facetious example. You see how bad it is. When was the last time you went for a physical exam by your doctor on your own, or because you had to? Meaning, you had some symptoms or something and you had to go, or you just decided to go. So better, how many months ago was your last physical exam? Again, I'm being purposely bad here, right? But the use of or can sometimes be confusing for people. So if you can avoid it, why not? Everyone should understand your items in the same way. How do you feel about your family doctor? So obviously one could say, well, what do you mean by feel? What if you don't have a family doctor? What if you have two? I was once in a situation where a family doctor of mine, his wife was also a family doctor. So I actually saw them both sometimes. They were interchangeable sometimes. When I went to the office, I didn't know who I would see sometimes. So how do you feel about your family doctor, right? I know that's a situation likely not happening today to have two family doctors, but I think you take the point, right? That it can be interpreted in different ways. Always just trying to watch our language. So with what frequency have you experienced this lately? How about how many times have you had this happen lately, right? A little bit better. Chelsea, yes, you want to say something?
Sorry, Holly, I know we started a bit late and you're probably in a crunch here trying to get through it, but I just want to add that all these things that you're talking about right now are a great way to make sure that you're doing this is to engage with the people who will be filling out the survey.
Oh, yes, absolutely. Absolutely. I will tell you, in that genome survey I was talking about, I had brought together a public advisory council with 3 people from Labrador. I was so happy. It's the only time I actually was successful in recruiting people from Labrador as well. I was so excited. For a year, they worked with me for a full year, and they actually were instrumental in reading through that survey and actually saying, Holly, this makes no sense at all. No one's going to understand this. Like, we're going to have to reword this to such and such. So they were fabulous. So yeah, and I'll say a little bit about that at the kind of toward the end, but 100% agree. By the way, Chelsea, I have no idea if we said this was an hour or an hour and a half or what time it is now. So just let me know what time it is now.
It's 12:49, Holly. And as for your earlier question, I honestly don't know myself, to be honest.
No, I don't. So
we
yeah.
we have an hour and a half out for it.
Okay, because we may not go the whole hour and a half, but I think I'll go a little bit past the hour, everyone, but we'll record it. So if you have to hop off, that's okay. So here's another example on the bottom here. About what time do you usually eat dinner? Well, in Newfoundland, as you may well know, many people refer to lunch as dinner and dinner as supper, for example, right? So about what time do you usually eat in the evening? Just a clearer sort of way of asking it, right? Here's some other sort of question design problems. Loaded questions. So look at this one. Do you support laws for seatbelts to save human lives? Well, who would say, no, not really? I don't think many would, right? So what do? Try to tone it down. So do you think that seatbelt legislation is required to reduce injuries from car crashes? Is less loaded, right? Compound questions. I used to do this all the time. I've gotten much better at this one now. How satisfied were you with the time and location of the support group? So if someone says very satisfied, how do you know if they were satisfied with both the time and the location or one or the other, right? So break it down a little. Double negatives. I also was very bad at this a long time ago. Lack of measles immunizations is not a problem in Newfoundland. It's confusing. You have to really stop and think, right? Lack of measles is not a problem. So you just try to remove the negative, right? Measles immunization is a problem in Newfoundland. Yes or no, disagree, etc. And the double-barreled questions. Do you bike to work to save money? Well, if someone says yes, how do you know if they're just saying, yes, I bike to work, or they do it purposely to save money? And for your study, depending on what the question is, it might actually matter that you get the answer to both those questions, right? So just try to ask in stages. A couple of other final thoughts on it. Leading questions. Most doctors believe that smoking leads to heart disease. Do you agree? Again, how many are going to say no? Probably not many, right? So it's a bit biased. Try to get rid of the bias and ask the statement a bit more neutrally. Jargon, acronyms, these are things that where you have those patient partners on your team or people with lived experience on whatever it is you're studying are so helpful. They nail me every time. They never miss, which is great. They say, Holly, don't know what this is. Never heard this term before. And you can imagine in an area such as mine, where a lot of my work is with inherited conditions, genome sequencing, newer technologies, it is complex. There is a lot of jargon in it. And it's tough to actually break it down in ways that make sense at a decent reading language level, you know? So I really need their help. So again, just using everyday language. Social determinants of health, this is probably less of an issue today, I think, because of the health accord, many more people are familiar with that term, but you could easily just say factors that affect your health would work as well, right? And spelling out the acronyms, of course, right? Something I'm getting much better with. Getting better, still not there. Okay, let's think a little bit about responses, because response options also matter. So we've talked about the items themselves, right? Some high level things about the items, but the response scales are tough too sometimes. So the way we ask a question really can sometimes determine the answer we get. This is a really good example from the literature. Patients favor radiation over surgery when you present radiation as having a 90% survival rate rather than a 10% mortality rate. The latter is perceived as more dangerous, but it's the same stat, right? Same statistic. So it's harder. That's a really in your face example, isn't it? Mortality, survival. Most of our surveys probably aren't quite so dramatic, you know? So it's tough to see it sometimes. But I've had some of my colleagues in the genetics department on that genome survey say to me, you know, Holly, I think you could do a better job of balancing out your vignette here in terms of presenting both the challenges and the benefits. So I was leaning one way more than the other. I forget now which way, but I said, oh, perfect. Okay. And so we did. So I hope that helped me, you know, eventually. So let's talk a little bit about the different types of response scales. And I'm sure you've all seen these or in your own life as you're filling out surveys. So we have the open-ended responses, of course, just as they are. open-ended, let people say what they wish. I'm a big fan of including open-ended responses on a survey, but not too many of them, because it's been my experience that not everyone will fill them out. And they can waste space and just add length to your survey. So I try to have a couple, 2 or 3 of things that I really would like to know a bit more about, particularly if a close-ended item would use a bit more explanation. So if I say to people, like on that genome survey, okay, would you tell me if you are interested in having your genome sequenced? I'll say that for now. So people could say yes or strongly agree. And some might say strongly disagree. So I want to know, well, what is, tell me a little bit more about that. Why would someone say strongly disagree and someone say strongly agree? So particularly if I want to have a little bit more sort of information, I'll ask it. So it's a bit selfish maybe on my part. Absolutely, they take longer to analyze. You're quite right. Quite right. The close-ended questions. Now, we have all kinds of different response scales here. The unordered are often used for demographics, right? What is your marital status? What is your major? What is your faculty, right? And they're very useful. Likert scales are the ones I probably use the most often. Not for any particular reason. I guess they just make sense, I think, in my work, right? But they're useful when items are similar and can be asked in banks. So surgery was the right decision. I regret the choice I made, etc. So for me, when I'm asking about genome sequencing, right, I'll have those 5 or 6 items about attitude and 5 or 6 about interest, etc. So I tend to use them a good bit. Frequency responses. How often do you manage acute, uncomplicated back pain without diagnostic imaging? Always, often, etc. So why might you use this one? Again, probably just depends on the way you want to report your findings. So if I wanted to say, 90% of family doctors in Newfoundland and Labrador often manage back pain without diagnostic imaging. Maybe I want to refer to it that way instead of saying, 80% of them agreed with this statement. It might just have to do with how you want to write the results up. I don't think there's any real right or wrong answer. Same thing here with numerical scales. Some prefer the numbers. How important is each of the following to you? What's nice about the numbers here is that, and we use something like this actually when we said to people, how important would the following factors be to you if you were making a decision about sharing your genomic data for research? So it very quickly allows you to see, oh, look, everyone here circled the 7. This factor is really important to people, for example, right? So it's just, I think it just depends on how you want to present your results. Same thing here, an adjectival scale. What is the person's family, a student's family history taking ability, right? Much below average, etc. Again, just a different way of doing it, depending on how you want to write it up. Visual analog scales. I see this every time I go to a physiotherapist for the first time, and they ask me to rate my pain or talk about how tingly something is, or is it burning, and I have to put marks on a scale. I actually find these really hard to complete, quite frankly. For me personally, I've never used these. I don't know exactly how I would analyze it. How would I analyze this? There's no number here. Anyone have any experience with these visual analog scales? Maybe you could teach me something here. So I've seen them, and they are a scale. I personally have never used them. I just want to make sure no one has their hand up, because sorry, I can't see it. I have to look. Okay, perfect.
Oh, sorry.
Perfect.
Karen says for pain
Perfect.
assessment, like you're saying, Holly.
Yep.
Yeah.
Yeah, perfect. Thanks, Karen. So that would make sense when I go to physio, for example. That's what they're asking me about. So I guess it's a matter of it allows a practitioner, I suppose, to fairly quickly see, oh, okay, this person seems to be in a lot of pain. Oh, okay, they're not too bad. I guess it's a bit of a quick sort of assessment that way. Makes sense. Makes sense. Yeah, perfect.
Oh, we have a few more comments coming in here.
Okay. Slide. I'll represent a certain number. Yep. Continuous data. Yeah, I would figure that as well, Deanne and Julia. Yeah, thank you. It would have to, wouldn't it? You'd have to give it a number in order to analyze it, right? Fair enough. And it's probably similar with these scales here, the semantic differential scales. I haven't seen these in a long time, but I remember way back when during my training in psychology, I think we used to use these all the time for a particular attitude type studies and whatnot, but again, you'd have to give them a number, wouldn't you, to analyze them? So that makes sense. So again, I just wanted to throw them all out there. I'm sure you've all seen them before on various surveys you've either done yourself or completed yourself. I don't think there's any hard or fast rule, or if there is, I don't think I'm aware of it. I just try to think about, again, what my research questions are and how I want to present my data, right? That set of items or that particular item, how do I want to write it up? How do I want to present it? What will be easiest for me to do that? What will give the most impact? So is it going to be a number, a mean, etc., that gives it that impact? Or is it going to be some adjective, depending on my audience and whatnot? So that's how I do it. I don't think there's any hard or fast rule really on them, but I throw them out there just so you can see all the different response scales. A couple of other thoughts about response bias. I am getting to the end, by the way, you'll be glad to know. Acquiescence, or the tendency to agree. This is likely in sections that have similar sounding questions. And that often happens with the Likert items, right? Because you're simply going, agree, 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 strongly agree, right? So the solution is to reverse half of the questions rather than intersperse, by the way. And that's also easier for reverse coding than later on when you're in your statistical package as well. So for example, these here are about clinical practice guidelines, right? These guidelines are easy to use. Oh, agree. They're easy to remember. Agree. They'll be useful in my practice, right? And then you see they switch. They are too much trouble to apply. The guidelines are too unsafe, etc. And it forces you as a respondent to think, to not just be saying, oh yeah, agree, or I disagree, right? You actually have to stop and think for a second. So that's a pretty easy thing to do. And I do that quite a lot in my work because I have a lot of Likert scales, right? Primacy recency. I think this is more of an issue in the telephone interviews, but it has definitely happened to me with Stats Canada interviews. Every time you'll be given a list. So they'll say, oh, I'm going to ask you a series of questions about blah, 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 where 1 means strongly agree and 5 means strongly disagree. Do you? And then they go A, B, C. By the time the 4th question comes, I've forgotten if the 1 is strongly agree or strongly disagree. I've already forgotten it by the time. So, are you currently taking any of the following pain medications, right? A, B, C, D, E. You're far better off to just divide that into multiple yes, no questions. Are you taking aspirin? Are you taking Tylenol? Are you taking ibuprofen, right? Whatever the case, far more easier on the respondent, I think, right? To do it that way. So people will more likely remember the first or the last item in a list. Framing, we talked about this earlier, right? That if you frame it in terms of a positive or negative outcome, it really will affect how people respond to it. There's a huge literature on framing, by the way. I haven't read it in a while, but I remember it from my early days of training. There was a big literature then. I'm sure it's huge now. So for this new drug, 99 out of 100 patients will survive for 5 years, or 1 in 100 will die in 5 years. People will respond more favorably to the first. So again, depending on what your survey is about, I've seen lots of surveys that have medical vignettes, medical scenarios, and they're using them for training purposes. So it really might matter how you have things framed. So if you can frame both, sort of show both the positive and the negative sides of whatever your issue is without adding too much length, obviously, to your survey, that will reduce bias. So I throw it out there. Okay, so moving on to pre-testing. You won't have time for it. Do it anyway. Do it. It really is important. So if you can do it at all, getting the target audience to look at your survey really is critical. You, your friends, your colleagues are not the target audience. But what I would say in my own work, I do it every time to my husband and my poor parents, none of whom are affiliated with the university or healthcare or the research I do. I get them to read every one of my general public surveys, and every single time, they will pick up on something I just haven't seen. So they'll want to respond in a way, and I don't have a response category they can use, or they'll read something and say to me, oh, so you mean blah, blah, blah. No, that's not at all what I mean. In fact, how are you seeing it? So I have to say, if it's a general public survey, I actually do share it with my friends and family who are not affiliated with research, who aren't researchers, who could care less about the research I do, right? And get them to have a look. I do find that helpful. But looking at the first thing we'll always do is have our colleague group look at it, whoever's on the investigator team, including our patient partners, of course, right? And then we're just asking the basic questions. Well, is all the content in there, the things we really need to know? God, is looking a bit too long. What can we remove? How are we really going to use this and analyze it, etc.? Does it make clinical sense? And does it make sense from patient partner perspectives? Is there something on that survey that just doesn't matter to them, but some other area living with that particular condition might be more important, etc.? So that can often be done within your team. But then if you can at all do some interviews with target respondents, this is so, so helpful. And I kind of do this with my parents and my husband. I say, well, tell me what you're thinking. Read out that, tell me what you're thinking with that question. And it makes sense in my general public samples, because quite frankly, they are a part of my target audience. They actually could fill out a survey on sequencing. It's meant for the general public. That's who it was meant for, right? Are they clear? Are the questions interpreted in the same way? And again, where someone wanted to put something in, wanted to respond in a certain way, but your response scale didn't allow it. Anything about the formatting that is annoying. When we were putting that genome survey together, I was telling you about the public council. They were really critical, I have to say, in just helping me to make sense of something like pharmacogenomic testing in a way that made sense to a lay public. So we talked about it as a group. They read out my little horribly written vignette, and we talked about it almost as a group. And it was so, so helpful. So I was very lucky with that survey because I had the 12 of them, right? I had a captive audience to talk through with it. But whenever you can do it, it really, truly is a helpful thing to do. I know it's tough sometimes to do it. But it's tough. It's good idea, good question, Deanne, about a pilot sample. I don't know about this is the next thing I'm coming to. Can we do a bit of a pilot study? I'm going to be honest, I've never done a full-blown pilot study. What I have done, however, purposely, whenever I do a survey, and I did it with the genome survey as well, is so I do my review with my investigator team, which now always includes patient partners. So I always have some members of the public on that team. Then we do our, like I said, I often will have access to a patient or public advisory council of some form, and I'll ask them to have a look with me to think about it. When it is a patient survey, which I've done as well, some of my clinical colleagues on the team, we also have patient partners on the team who live with the condition. So we will set up a meeting where we talk through the questions. I ask them, what's coming to your mind now if you were going to fill that out, etc. I usually feel pretty good after doing those 2 stages, to be honest with you. But what I will do in terms of a semi-pilot study or a lazy pilot study, I'll be quite honest, because let's face it, we're often under great time constraints, right? It's hard enough to get a sample of people to respond. Everyone is so busy and overburdened and over-researched, I think. So this is my compromise. So when we did the genome survey, we went through those first 2 stages, felt pretty good about it, had the public council fully go through it many, many times, had my colleagues at Provincial Medical Genetics also go through it. They had brilliant feedback as well. I felt pretty good about it. But when the survey went live, the first 100 responses, it was an email survey, online email. When the first 100 responses came in, I actually analyzed them as if it were a pilot study. I said, okay, I'm going to and I did that in a day very quickly. I looked at them. I did all the frequencies just to see, were any questions not being answered at all? Was anything being skipped? People answering the open-ended? What was it looking like? Where there was and it looked pretty good. Like I didn't see any big horrific problems. If I had seen that, well, look at this question here, all 100 people seem to have answered in a way that I did not expect. Oh, wait, now maybe that's being misinterpreted. If that were the case, I would have made changes to the survey and relaunched it, because I could have done it. It was an online survey, right? Wasn't perfect. That is not the perfect way to do it. I could have said, okay, I'm just going to advertise it for 1 day. Whatever I get, I'm going to stop. That's going to be my pilot. And then I'll forget those data and then I'll launch it. I could have done that. I didn't, because I only had a full year, 1 year. I have 1 year. Deanne, you're with me. A lazy pilot pretest. Love it. So it's not perfect, but it is a suggestion, right? a suggestion. Let me just have a look at Karen's, and Chelsea, I know you've got your hand up too. Credit for grade level should be, oh yes, smart, yes, yes, yes. You know what, I'm sure you're absolutely correct. That there are. I mean, I always try to use the grade 8 level that we use for all of our ethics applications, for example, right? So that's what I try to do, and I just run it through the Word, Microsoft Word, reading, what is it, Flesh Kincaid or something, Scholar Kincaid or something like that. That's what I do, Karen. I don't know, you probably should also be at a grade 6 or less, quite frankly. You're probably right, even for general public surveys. Yeah, so Amy, if the survey had to be changed, great question, by the way. Can you change a survey? You've already launched it. You've made changes to it. I would only do that if the changes were very small. So for example, and administrative. So if I thought that I had to reword an item slightly, that really didn't change the length of the survey, didn't add a whole new section, I would never do anything like that, add a big new section or something. But if there were small changes, or for example, let's say I decided to use, I don't know, a 7-point Likert scale instead of a 5-point Likert scale, for example, or remove an open-ended question. I would be comfortable doing that as an administrative change that really I would not anticipate affecting response rate horribly. If anything, it would make things less burdensome to people, right? But you're right, if you were making any big changes, you'd absolutely have to do it. And of course, the ideal thing to do, as we all know, the ideal thing to do is to do the actual pilot, right? That's the ideal thing to do, right? I think we often don't do that because we just don't have time. I think that's why, right? Yeah, Amy, good question. If I had any questions about, well, usually what I do, to be quite honest with you, I often will email ethics, HREB for me. I'll often email them and say, hey, listen, I'm thinking about making this small change. I think it's administrative. What do you think? So usually, yes, I will get have that verbal conversation first, by the way. I've done that so often now, it's probably why I'm talking as if I know that will be okay. I feel it will, because I've had that discussion a lot with them, right? But that does, yeah, I agree, Amy. That's a great question. And it does make sense. You're right. I mean, we want to do things appropriately, right? For sure. So look, if you can do the pilot study, even on a small scale, it's worth doing. But I'm going to be 100% honest. I recognize, folks, we're busy and we have limited funding and time. It's not always that hard, that easy. But this is really important. When you've done all of that, get someone to look at it who knows nothing about it. That could be an administrative person in your department. It could be I don't know, someone at the post office. It doesn't matter. Someone who has nothing to do with it at all. They're just looking for overall flow and small mistakes, because we all know when we look at something for so long, you miss it sometimes, right? If you can only do one, having even a couple of interviews with that target audience is probably the most important. And nowadays, a lot of our research, we do have patient partners on our team. They often are the target audience. So even if you can only do that with a couple, there is real value in doing that, okay? So it makes a difference. Last thing I want to say is this is really funny story. So there is a whole literature now, okay, examining factors that impact response rates. Often this is in the context of mail-out surveys, okay, postal surveys. Note also that some of the factors that have been shown to improve response rate in the general public may not work in targeted samples, such as general practitioners, for example. There's a whole literature on that as well. But if you're going to do a mail-out survey, many of the decisions that you might have to make, like, should I have my pages double-sided? Single-sided? What do I need a cover page? What color should it be? They have actually been tested empirically. I had a student back in 2017. We were doing a mail out to a particular group of patients in Newfoundland, Labrador, who had colon cancer, stage 4 colon cancer. I won't bore you with why. That was the sample. There was 600 plus of them, sadly. There was a lot, sadly. So my student came to me and she said, can I make this a certain color? Does it have to be white? I said, oh, I don't really know. Why? What do you mean? She said, well, I was just reading this article that showed a higher response rate. And I forget the color we went with. I think it was pink. This is 2017. I think it was pink or yellow. I'm forgetting. Still have them in my office. And she said, I want to print them this color. I said, you go right ahead. Let's do it. So we did. We printed them in the color that the literature told us will give the higher response rate. The other thing we did, because we didn't have unlimited time or money, but we did do these first 3 steps. This is the Dillman method. that has been shown to increase rates in both general public and general practitioner samples, by the way, particularly for a mail-out survey. So we sent out a letter. We had help with the Cancer Center, okay, we didn't have people's names, of course, but they did. So we worked with the Cancer Center and we sent out a little postcard, right, that said, we're going to be doing this survey. Here's what it's about. You're going to see it come in your mailbox. A week later, whatever it was, 8, 9, 10 days later, we sent the survey with the cover letter printed in pink or yellow, whatever it was, the whole survey, not just cover letter. And then we sent a reminder postcard. We didn't have the money or the time to allow for the last steps, but we did do the first 3. And this, her survey, a mail out survey of, I would argue, a pretty sensitive population, vulnerable population, had a response rate of almost 70%. We had 370 people responded, and boy, it was not a short survey. It was, we had a lot on it, and it was a complicated topic. Tumor testing, tumor testing. It wasn't an easy topic. Really, and I couldn't believe it, and we laughed, right? And we said, "My God, I wonder if the pink really did up the response rates." Now I regret, of course, that we didn't send half of them in white and half of them in the color, and then we could have tested the response rates. By the way, that's what people do who study surveys. So, in any event, many of the decisions you will have to make have been empirically tested. Okay, so I know we're getting over time or where we are now. I have no clock in front of me. I'm sorry. What I'll finish off with is this. Putting together a survey really is time consuming. It does get a bit easier, but not that much, by the way, not that much easier. I've got to be honest. But take the time up front. I really think it's worth the time up front. It makes things a lot easier at the end of the day. Here are just a couple of links that I kind of like, little tips and writing tips about surveys. So with that, I'm going to stop my sharing. I want to say thank you to all of those of you, first of all, who have already had a lot of comments and whatnot in the chat. I really appreciate that. Any final thoughts or questions? Oh my God, it's 1:15. I'm so sorry. Thanks everyone for sticking around. And
No, thank you, Holly. You don't have to apologize. This is so informative.
oh, good. I always hope it is. So anyone have any final thoughts or questions before we sign off for the day?
Holly, do you mind if I share your email? You mentioned sharing that survey. So if I'm going to put a few links in the chat here. So if you don't mind.
Please do. Yeah, that study, we've had a few articles out from that now. Actually, the survey is probably available online, but I have no trouble shooting it off. So yes, that's the quickest way to do it. Yeah, Karen.
Hi, Holly. Thanks so much for that. That was really, really helpful. I learned a lot. And all of your examples really helped me to understand the different concepts. You have so much experience. It's really, really helpful for me. My question was actually about the Likert scales, and I apologize that my camera is not on, but you don't want to see me today.
Not to worry.
Thank you. Do you find it's better, or is there any sort of guidelines on if 1 should be strongly agree or if 5 should be strongly agree? Right. And the reason I asked that is I noticed when you shared the example, I think you had strongly agree as 1 and you had disagree as 5. And I was just wondering, is there recommendations on that, if you don't mind answering this?
Excellent question. And so yeah, that's an excellent question. I don't know if there are recommendations in the literature on that. However, I will say that when I have done that in the past, I almost always kick myself, because when it comes time for analysis, I have to recode it, because it makes more sense for strongly agree to be the higher number usually, right? If you're measuring something positive or supportive, or do people support this movement of, amalgamating our health authorities into one, for example, right? Strongly agree, but it might make more sense, to say that. I think it depends on exactly what your item is. And again, I think back to analysis. If I want to say, the higher the people scored on this item, the more positive they were, the more supportive they were, or the least supportive they were, etc. I think it makes more sense, Karen, based on the content of your item. When you're writing it up, what doesn't make sense for me to say? But if you're using a mean, if you're going to be reporting a mean, as I was on that genome survey, I actually did have strongly agree as number 1. And for readers, that made less sense. I was saying you know, people are very supportive, very interested in getting their genome tested with a mean of 1.2. Made no sense. So I had to reverse code it in my statistical package in SPSS. I just had to reverse it all, which so it's just a bit more work for me, but then it made much more sense to the reader. So I'm glad you picked up on that. That's an excellent question. Probably more about thinking about how am I going to write this up and what will make more sense.
Okay, thanks very much.
Yep,
Yeah,
perfect.
okay. Because the less work we have to do with the
Yes.
coding and the analysis, the better.
Exactly.
Okay, thanks
So
a million.
you got it. Like I said, everyone learn from my many mistakes. That's the point. That's right. Yeah, Chelsea.
No, I just wanted to that was a really good point about the coding. I just wanted to
Yeah.
add to that, Karen, to say that in my experience, it's also helpful from the reader's perspective if you
Yes.
can avoid numbers altogether and actually write out what each of those numbers means to you, because if it's strongly agree, a bunch of numbers, strongly disagree. Well, if sometimes a 4 doesn't really mean anything to anybody. It's not,
Yeah.
it's not defined very well. So
Yes, that makes total sense, Chelsea.
Yeah. Yeah. Indeed it does.
Thank you.
Yeah.
no problem.
Yeah, Deanne.
Hi, thank you so much. This was excellent, by the way.
Oh, good.
I had a question about, so I'm planning on using a questionnaire in my survey study that was designed to be used related to critical care areas and has since been adapted and used in primary care. And then my research is related to primary care. They did validate the survey for face and content validity and construct validity in the primary care study, but they did not report internal consistency. And I did contact the researcher and ask if they ran it and just didn't report it, but they actually didn't assess it.
Oh, really?
Yeah, so I'm wondering, and bearing in mind that I'm a PhD student, what your recommendations might be around using this survey, considering that would be a limitation.
Well, so something, because I think what I might say is because it has, I'm assuming it has decent validity. I'm going to say they were pretty good or decent validity. I think I might say, to avoid creating a whole new other scale, we will use the scale if it makes sense in your area, that face and content validity looks reasonable. The construct validity, you've got some stats on that or whatnot. I would point blank say original authors did not measure reliability, but we will. So you might actually be able to contribute to the literature by doing that in your sample, which is kind of nice to be able to do that. Like you say, you just got to be honest and say, look, we can't compare the reliability of this scale to another because we don't have that stat. But hopefully you'll have a decent Chromevax alpha from your own, hopefully you will, right? Which
hopefully.
I think because it has decent validity, and in an effort not to put yet another survey out into the literature that may never be used again, kind of thing, I think you can make the argument to use it. And I'd be kind of curious to see what your reliability will be.
yeah, exactly. And it had excellent reliability in the critical care area. It's just that, primary care and the fact that it hasn't been evaluated for reliability in that setting. But yeah, so thank you. That's really helpful.
Yeah, that makes sense. I think you can get away with it because you have the decent numbers in the other area. Yeah, that makes sense.
Thanks a lot.
Yeah, makes sense. Makes sense.
Any other questions or comments?
Good.
If there's nothing else, I'll just say a very big thank you to Holly for once again delivering an excellent session as part of our training program, as part of our research design series here. We do have another, the 4th or the 5th in our research design series coming up on April 12th. That'll be Dr. Ajay, who's coming to speak about the research impacting Indigenous groups policy at the university here, and how that's going and how it's been applied. Our research program Quality of Care also has their own webinar series called Healthy Discussions. Those are all recorded and the link is above in the chat there, but you can stay up to date on their upcoming sessions. They'll be doing another one in April as well. And speaking of surveys, I'll be sending you all a survey to evaluate this. Just a quick 4-item 4-item survey to make sure that we're achieving what we mean to here with this training program. So, and I want to thank you all for traveling with us across platforms and
everyone.
joining us here today.
Yeah, thanks everyone. I appreciate you doing that, and I appreciate all the great engagement in the chat. That's always nice when it's really great. So I appreciate that. Thanks very much. And
I hope
yes, so sorry about the WebEx.
No, not your fault, Holly, not at all. I hope everyone has a wonderful, wonderful rest of your day.
Thanks. Thanks everyone. Thanks, Chelsea.
Yeah. Thanks,
See you
Holly.
soon.
Bye-bye.
Take care. See you soon.